So let's start with just some introductions. My name is Carol Himmelgarn, and I am the program director for this program called the Executive Masters in Clinical Quality, Safety, and Leadership at Georgetown University. And also with me today is Jackie Stark. And Jackie is the program coordinator, but really what I say is Jackie is jack of all trades. She does so much with the program on providing information, getting students through admissions, all of the questions and the logistics is Jackie's forte. But I will say any questions you have, you are free to reach out to both of us during this session and afterwards. So I just want to orient everyone a little bit. Why is patient safety so important? Well, most people in the field know that the landmark study was To Err Is Human, which came out in about 1999. And this really opened up people's eyes to the need that healthcare is not a real safe industry. And this report created different suggestions on how we improve healthcare. But the other one I like to bring up is a book that came out a few years after To Err Is Human called The Wall of Silence. This was written by Rosemary Gibson. And what this really tells is the stories of patients and families that have been harmed and how the system broke down and what it looks like from the personal perspective. And the two of them, I think, are really go hand in hand on forming why we need to have education around patient safety and quality. So To Err Is Human comes out, and several years after, people started to look and say, have we improved healthcare based on the recommendations from To Err Is Human? 5 years after the book and the awareness came out, Dr. Leap and Berwick did an analysis, and they're like, well, have we improved in 5 years? And they gave a grade of about a C+ on the different things in there: infections, technology, communication. Then 10 years after, Dr. Robert Wagner came out and said, all right, it's 10 years. What do we look like now? He gave the score of a B- and said, technology, we've gotten better. We've gotten better in some of the hospital-acquired infections, but we still haven't achieved the goal that we should be achieving. And then 2 decades later, Dr. Bates and Singh did the same assessment and realized that we really haven't met a lot of the goals that we were supposed to in Err Is Human. While we have made great progress with technology, I say that, but then on the flip side, we know technology has created unintended consequences. We've come a long way in that space. So earlier this year, COVID has been impacting, but the CDC and CMS actually came out and said, we have drifted. We've actually gone backwards in patient safety. So up until COVID, many people don't realize that medical errors were the third leading cause of death in the United States. COVID now has dropped that to the fourth. We know that healthcare is error prone, and we have to figure out a way to make it safer for patients and family, but for providers and for the organization. So a lot of people hear the analogy that when you say that anywhere from 200 to 440,000 people lose their lives a year due to medical errors, that is like 2 jumbo jets crashing every day. That is an astronomical number. And yet people are like, well, why aren't we doing something? Well, when a plane comes down, everyone knows all of those lives are lost together, oftentimes right there. But in healthcare, it may be 2 lives in this hospital and 3 in this one down the street and 5 in another state. People don't have a sense and aggregate all of those lives. In healthcare, when you look at the industries that are high risk, commercial aviation, railroads, nuclear power, they have become ultra safe organizations. Healthcare, we are not. If you see on this specific graph, healthcare is riskier than bungee jumping. 1 in 500,000 people lose their life a year bungee jumping. More lose their life in the healthcare system. So what do we need to do? Well, we need to think differently. We actually need to look at healthcare through a safety lens. And what is great about this program is that we really, it's real world application. There's a lot of programs out there that are great programs that are based more in theory. Our motto is what you learn today in the class, you should be able to apply tomorrow in your organization. We don't want this to be esoteric. We want it to be applicable. So one of the things that we have realized over the years, if you're going to change organizations, be it ambulatory, acute, long-term care, the various healthcare environments out there, it combines several things. You have to have patient safety, you have to have quality, and you have to have leadership. These are all inextricably linked together. So let's talk a little bit about the program. There's two different arms of the program. There's the master's program and the certificates. So let's start with the master's side. The master's is a 16-month program, 32 credits. It is an online asynchronous program. However, I always like to tell people, we do hold inline live sessions. The various faculty will get on. They will meet with students live. And we do this because a lot of students wanted that interaction. But if you don't want to be part of it, you don't have to be. And that is because we realize a lot of our people are frontline healthcare workers. They may be on call, they may have shift work. So what we have done is we make it work for everybody. We make it be truly asynchronous, but have synchronous sessions, and we record those so that if you want to partake, but you can't, you still don't miss out on that learning. We have 7 courses. And we have something called a longitudinal capstone. And let me explain this briefly because it confuses people. The longitudinal capstone goes throughout the whole program. And the reason for this is most programs wait and do a capstone at the end, and it causes a lot of angst and anxiety in students. We do this so that you can keep working on it as you go through the program. So what happens is you take your course, and then the week after is your capstone course. So you are never taking 2 courses simultaneously. And the capstone follows each course as you go through the program. We have 2 tracks at the end of the program. The first 5 courses everyone is required to take. At the end, you can take 1 or 2 tracks. You can do a human factors track, or you can do what we call our quality and safety track. We do provide full-time and part-time options. And then there is a mandatory 3-day on-site at Georgetown University, and that is during the 5th course. And you can see the cost of the program is roughly around $52,000. On our certificate side, that is 3 courses. Everyone takes the first 2. And I'll get into the courses a little bit more in this presentation. And then you have the option of the 3rd course that you want to take. This is only full-time. You take the 3 courses. It is online. It's the same design as the master's program. In fact, the courses are together. And this is a little over $19,000. So just a little bit about the courses. They run consecutively. First course is Introduction to Patient Safety and Quality. So this is just getting everyone on the same sheet of music. What is safety and quality? What are these terms that we hear, like the Swiss cheese model? What's patient engagement? What's psychological safety? Just getting everyone to understand some of the vernacular and the basics of patient safety and quality. The second course, Patient Safety Science and Risk Mitigation, is looking at sort of harm. How are reporting structures? What does reporting look like? What are failure mode effectiveness analysis? event reviews, or what a lot of people call root cause analysis. How do we learn more of the science? What role does IT play in healthcare? Human factors. So this is that science part, and we take it looking at it through like a medical error type of lens, because all of those different steps are involved in that process. The third course is quality improvement. This is all around PDSA cycles, lean, all of those quality measures. In this course as well, we have partnered with NAHQ. So those of you that may know the National Association for Healthcare Quality, or perhaps you know the CPSQ exam, we use NAHQ's book, our intellectual capital with the professor that teaches it, and real-world experiences. And you are able to sit for the CPHQ exam after this course. So I can tell you there's several organizations now in certain roles that want you to have the CPHQ certification. And we have gotten several students that come through that do the master's and are doing it, one, when they want the whole master's, but because they're ready to sit for the CPHQ. Like they've taken the course, they've read the book, they feel prepared to take the exam. So it's just something that is a plus with the program. The fourth course is leadership. And this is such an important course because if you're going to go out there and make change, you have to be able to lead. And our professor that teaches this does this at a national level. The fifth course is all about communication, teamwork, bias in healthcare. And this is where the on-site occurs in this fifth course. And again, as I said, you're taking your capstone after each one of those different courses. So our two elective tracks, and you don't have to decide which track you want to take until you're in your fifth course. So the quality and safety track, the first class is policy, regulation, and economics. This gets into the business side of safety and healthcare. What role does CMS play? What is Joint Commission? What are the costs of healthcare? What is your local state health department? So this is all, again, business of healthcare quality and safety. And the last course in this track is called Creating and Leading Sustainable Change. This is about change management models. Cotter's model, if any of you have read it, Cotter's book, Lewin. So you learn leadership skills and techniques and who you are as a leader in 504. In 507, this takes it then, how is you as a leader, how are you going to implement change? How are you going to make your colleagues do different? What are those skills that you need to do and use? The human factors track. Human factors is just such an important part of healthcare now. And in this track, the first course is taught by two of the leaders in human factors across the world. And what you learn here is what are those principles? So how do you look at ergonomics? So let's take, for instance, you're building a new hospital. How do you look at the best workflow of a hospital so you don't have to walk as much and there's safety? What are the cognitive roles that play in human factors, our brain and how we interact with things? The second course is all about applying those skills. So for instance, one of the cognitive reasoning, maybe the issue is you have a patient that needs a heart and you have 10 qualified patients. And they all have different reasons they would benefit with for the heart. What is the cognitive process? Not just the ethical, but what is that cognitive process that you would walk through? So I mentioned our certificates. So the first certificate in patient safety and quality goes through those first three classes: the introduction, the risk and science and mitigation, and the quality improvements. The second certificate is our leadership. So it goes through the first two classes, but you take the leadership class for this certificate. A little bit about our mix of students. We have such a variety of students, and that's what we pride ourselves on, is because we want interprofessional learning. And so our groups are nurses, PharmDs, physicians, we have business people, we have patient advocates, we have military, allied health, respiratory therapists, physical therapists. We have we've had several people on the business side that are running like organ transplant, or they're in the vascular center. So everyone brings a diverse perspective to the cohort in the learning. Opportunities for growth. We've had people go into consultant roles with Booz Allen. We've had people step up into directors in different levels, be a director of quality, safety. It all depends on how organizations bucket their different roles. Chief safety officer. We've had people go into directing high reliability with what they've learned, risk management. So, I mean, opportunities are definitely out there for growth. And just the diversity of our faculty. We just had to have an accreditation process, and any of you that have gone through Joint Commission, that is what our life has been like the last year, going through this accreditation process. And the feedback we got from the accreditors was the depth and breadth of our faculty, which is just amazing. We have cardiothoracic surgeons, we have nurses, we have PhDs that are PhDs in human factors, patient advocates, I mean, quality improvement people that with black belts. So the people that you learn from are doing the work. They're not people that just studied it. They actually live and breathe and do it. And that's what makes the program so rich, is everyone's sharing their experiences. So Jackie, do you want to just talk a little bit more about the courses, and I'll let you take the next couple slides.
Hi, yeah, happy to jump in. So one thing we want to talk about, and Carol did touch on this briefly, is that our courses do not overlap. So when you see, for example, if you were to start in fall semester, if you were to see, you would take 501, that course would last for 6 weeks, and then immediately following, you would take the 1 week of capstone and start with your capstone instructor in building your project that you'll take on for the remainder of the program. You'd then get a week off, then you would take course 502 for 6 weeks, followed by 1 week of capstone. And so that is the way that the program is lined up. So that way, again, you're not overlapping courses, and that way you are getting that individual time with your capstone instructor, and you can build on that project along the way. Next slide, Carol.
Oh, right.
So much. The other thing I want to touch on is working with your institution to discuss educational assistance opportunities. A lot of organizations are now offering benefits through things like EdAssist, through HR, where they will help provide and assist payment towards your education. So I highly recommend everyone reach out to their organizations. And additionally, if you are military or you are a veteran, we have phenomenal military benefits through Georgetown, and I'd be happy to discuss that in more detail if that's something that you'd be interested in discussing. Additionally, admissions deadlines, the one is coming up, it's right around the corner. Spring is November 1st. So there's still about 3 weeks left to submit applications. If you do want to start in spring will start January in 2023, and it will go until the following spring. Again, the program's only 16 months. If you are interested in fall, you have until July 1st to submit an application.
So here's our QR code with more information. And what we're going to do now is we're going to open it up for questions. And, you know, we're here and happy to answer anything that you would like to discuss.